A neurotrauma rehabilitation unit cares for those patients that have had some sort of neurologic trauma. Oftentimes that trauma is a result of some sort of traumatic or catastrophic accident. Sometimes with these catastrophic accidents, the brain can be affected. In addition, the spinal cord can be affected. Sometimes that impairs the way people's arms and legs move, ultimately then impairing their mobility. And oftentimes people can have fractures related to these accidents.
Because of complexity of the damage to the brain or spinal cord, and then one single physician or one single person can handle this. So therefore, we need to form care team to handle entire scope of the patient care.
We have encompassed everything that a patient needs on this unit, and we have provided an environment that really supports their healing and their well-being, as well as really giving it a good environment for their therapeutic services.
The patients get a lot of personalized attention. There's consistency with the therapist, where the therapist is always working with the same patient. They get to know each other and develop a relationship and develop that bond of trust. Families come and interact with therapy and participate and start to feel more comfortable in taking the patient home.
We've been able to assemble a team that is quite both diverse as well as having the multiple complex specialties that may be involved in these patients through their continuum of care. The residents are involved with patients from the point of within 24 hours of admission in acute care through long-term acute care patients programs, inpatient rehabilitation, subacute rehabilitation, outpatient therapy, and clinics. And with some patients, they actually do get to see these patients for all the years of their residency, and they actually get to see the progress a patient makes. That's very rewarding.
Our goal is patient-centered. Patient, family are the one got to be satisfied the outcome of the rehabilitation is. So regardless of what that is, ultimate success is coming from the patient's own satisfaction.
Well, I was on my dad's roof of his house. He died in December. So I was trying to get the house prepped for sale. And I took his extension ladder, put it up on the side of the house, went up there, cleaned some gutters. Everything was going well. And then all of a sudden, the ladder just collapsed. And I ended up going about 100 miles an hour down. Then the paramedics came to the scene very quickly and put me into the ambulance very carefully. I couldn't feel anything. And at that point, I knew my life changed. The trauma team, the therapists, the doctors, and the night staff, the nursing staff, they all did an excellent job in reassuring me that I was going to be okay and that this is something that will pass over time. You know, I would explain to Dr. Maythaler or someone else what my problems were, and then the whole team, the therapists were there, and the nursing staff was there, and everybody was there. The communication there is fantastic, and I think that's the key to their success.
In order for them to stay motivated, you have to celebrate the small successes, because sometimes the success is not huge. It's not something you can see right away, and they're just little small steps. And I think you have to keep showing that to them and their families. Well, remember, you couldn't feed yourself, you know, a week or two ago. Look at you now. You're doing it. So it's the small successes, I think, is what keeps them motivated.
Since we opened in January of 2012, we have seen nearly 200 patients, which has completely exceeded what we expected. So that to me really tells me that there's just been a great need in the community, and we're really serving the needs of our patients in this community.
What I'm most proud of is the fact that Oakwood identified a need in the community, because it all gets back to serving a need. That's why we're all here. That's our mission. We saw a need, we developed a program, we recruited amazing team players, and now our patients and families are benefiting from that.
Best part of my job, I think, is the reward I get from seeing a patient who comes in barely able to move and then goes home with the family, being able to just walk with a walker or a cane. That's very rewarding.
The standard of excellence in their care is top notch, and I brag about it all the time. I'm very proud about working here.
I really enjoy being a part of their rehab journey, just to see them progress. You know, be there at admission when they're so scared and so debilitated, and then on discharge, when they can go home and walk out of here. It's beautiful. I enjoy being a part of that.
Oakwood Heritage System is truly a team of excellence. They really, truly care about the patient, and that's what made me feel at home.
Patients always come first here, yes.